Ian, what's your like steps? You've done a bunch of these HRPs. What are your tips for people that haven't really done these or are looking to get these done right?
Well, you know, it's you have to go in with a baseline plan, and then there's a lot of modularity to this. So as you mentioned, there's different amounts of lateralization on that proximal body that you can trial. I think the biggest thing is these are these are patients, as we've already talked about, that we're worried about instability. So if there is any soft tissue that I can preserve, I try to preserve it. But on the flip side of that, you have to do good posterior releases because these tend to dislocate anteriorly, like all prostheses tend to do. And if there's any contracture in the back that either you have created in trying to repair a tuberosity or just exists from just scarring, that has to get out, or it will keep coming out. The other thing is this one, fortunately, she has enough bone that it's not getting anywhere near the deltoid insertion. Um, but Melissa, if this did extend to where deltoid insertion is compromised, I'm certainly going to want to repair that. Um, and then when these extend even further down, if it goes beyond 50% of the humerus, I will also plate that much like an APC, purely for rotational control, because that prosthesis is cemented, which is great. It's a circular, stem distally, but those little flanges at the top give some rotational control. So when it's this size, I think you get good rotational control with that. Otherwise, I worry about rotational control. So I'll plate that even as a sort of a belt and suspenders.